Repairing your torn rotator cuff tendon is only the first step in your road to recovery. Your postoperative rehab, done over the next several months, plays a major role in your success. In the first 4 to 6 weeks of therapy, you'll be doing what is known as passive range of motion. That is, your therapist will be moving your shoulder, but you won't be firing the muscles yourself. During this time, you'll be wearing a sling. Over the next 4 to 6 weeks, you'll do what is known as an active range of motion. You'll be moving the shoulder yourself, and your therapist will be aiding you. In the last 4 to 6 weeks, we work on the strengthening of the muscles around your shoulder. This will be done under the direction of your therapist.
The day after your surgery, you'll come in for physical therapy, and we will remove the sling, remove the bandages, and the first thing that's very important is to achieve passive range of motion. Keith, we're going to do some passive range of motion for home. This is what I want you to do at home to keep your arm loose. Now understand, you're not going to be actively moving your arm or using the table to help you to keep it loose without you contracting the muscle. Because as we said before, you don't want to do that because that'll pull on the repair that the doctor just fixed. Okay? So I want you to slide your arm on the towel, keep your hand on the towel, and you're going to slide forward, lean your body forward, and you're pushing your arm forward, put your head down, and then as you come back, you're going to use your trunk to pull your arm back. Keep your shoulder back and down, and you're going to put your shoulder blade in your back pocket. Good. We will move your shoulder for you. You're not permitted to move it yourself because if you move it yourself, you are contracting the muscle that the doctor just attached back to the bone or back to the tendon, depending on the type of tear. And back. The sling is important to be worn according to how the doctor recommends. Sometimes it will be for a week, and sometimes it will be up to 6 weeks. The active phase generally occurs at 6 weeks, and that's the phase where you're allowed to get out of the sling and start actively moving your shoulder. This does not mean lifting weights. This just means we're re-educating the muscles to teach your body how to reincorporate the rotator cuff into normal function. And that will include just lifting your arm up against gravity and going through normal functional movement patterns to fix your hair, get dressed, feed yourself, things like that. The final step is the strengthening phase, and that generally occurs around 12 weeks. And that means we start resisted exercise to help strengthen the muscles so that you can do more active activities such as lifting your grandchild, picking up a grocery bag, picking up your briefcase, things like that. The communication between the doctor and the therapist is crucial. In fact, the doctor gives us lots of information on your first visit, so we know exactly what he did when he repaired your shoulder. I know if it's a little tear or a large tear, and how quickly we can move and how aggressive we can become. It's important to keep up on a home exercise program because your shoulder is going through a healing process. Your body's laying down scar tissue to heal the repair. If you don't move it in a normal fashion, your body will lay down lots of scar tissue, and you could develop a frozen shoulder or a shoulder that doesn't move correctly, which will inhibit your function even after the repair is healed. So it's important to do the exercises on a daily basis as instructed by your therapist so that we can restore you to full function as soon as possible.
Sometimes rotator cuff tears are unavoidable, especially if you've had an acute injury. However, there are modifications you can make in your daily activities to help prevent them from occurring or from re-tearing if you've already had a repair. Tips on preventing rotator cuff tears and re-tears are, first of all, maintain the strength and range of motion of your shoulder. Avoid repetitive overhead motions as much as possible. Do not lift heavy objects without assistance. Avoid falling on your shoulder. Try to perform the home exercises given to you by your therapist. Here at Coordinated Health, we work as a team in your treatment and recovery. But remember, you're the most important member of that team. You hold the keys to the success of your own treatment. Your consistent effort during and after treatment build a foundation for maintaining a pain-free shoulder. Take what we teach you, apply it in your daily life. Take a little time every day to stretch and strengthen your shoulder. This has a tremendous impact, preventing pain and loss of function. And that's the art of medicine.